Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $2 million mark and beyond. I'm kind of changing it now as I'm trying to get to the 2 million mark and kind of go over some things. But I want to go over some questions. This is a question actually that came from Allison, one of the listeners of the podcast. She emails me. Once again, if you guys have other questions, you can email me. I'll probably make an episode on it because it gives me a lot of the fodder for what I talk about. So she was considering doing EBM medical products in her own office, and she's asking kind of how it's been working. So I have been doing EBM for literally only a few weeks, okay? And you're gonna laugh. You might think I'm a fast adopter. I'm a really slow adopter, and I think part of the reason I have drag is because I don't mean this demeaning anyway, but I have partners. So I have 2 other partners and 1 other associate, and so one of the good things is I can't do everything that I want to do. I have to bring it to my partners, and we have to agree on it as a group, and it has to make sense. Because if it was up to me, I would do everything and spend all the money in the world for this. Okay, so I have been doing EBM, and so if I look here in the time that I've been doing it, I'm just pulling up my list here of how many patients that I've had. So what's worked for us? Okay, so sure, a few questions. Our pricing. How much do you typically charge patients above the wholesale cost? So they talk about this like you can charge whatever you want. I really just did whatever Taft told me to do. So basically they had a markup that they did, and I just kept that markup. And so I tend to tell patients, okay, it's probably about $60 per month per product, 60 to 75, and they're usually okay paying that. I didn't mark it up more, and I actually just took the average markup that they recommended. Rationale and transparency. So how do you frame these types of things? So how do I frame these products and being transparent about the cost and economics? So I don't really talk much about that aspect. So I basically, the only ones I've been doing really are if I have patients that are on blood thinners, they really can't take Motrin or ibuprofen, or if they have stomach issues, or if I'm doing shockwave. So those are the ones I'm doing these anti-inflammatory, like turmeric, one of these turmeric ones that they have here. I did also one for fibromas because I didn't have a great verapamil, so I just say, this is a compounded one for a fibroma. And I did one as well, I think it was for circulation, or like Raynaud's. I don't have any great things for Raynaud's. And there was one for pain, for like neuropathy, They have creams and pills. And so these I really don't go much into the cost. I just say it's about 60 to 75 per month. I would try it for 3 months, and if it doesn't work, I would stop it. So that's how I do it. Resources. So there are some different resources EBM has. You can reach out to your rep. They'll share those resources. There was a good one that I watched, which went through kind of all the items. It was pretty much just a really big sales spiel about how all they work, but he sounded really professional about it. And I think by listening to that a few times, you can get used to using EBM. She asked about experience, how it's been working so far. I really don't have any specific experience. I'm just trying it out for patients. And I guess the other thing I did that really made it work well is I put a tab on my browser for EBM. So when I'm in a treatment room, I basically copy and paste the date of birth, the cell phone, and then the patient's name, and I just paste it in there, and I can do the prescription via their portal. They can also get you like a proxy account, which I'm going to do for my scribe. So my scribe is going to be doing the prescriptions for me. And then the other thing is I made a favorites in terms of my prescriptions. I have some favorites here. So I put these into... I'm going to put these into a little I don't know. I'm going to call it like on my Podiatry Practice Mastery. If you go down to the bottom, it's going to talk about like EBM. I call it an EBM masterclass. And so in there, you can get all my resources. You can see the favorites that I'm using. I'm going to put some links to some of these podcast episodes where I'm talking about EBM. So it's all in one place. So if you want that, if you want to know kind of how I'm doing it, how I'm setting it up in these different resources, I'll put that on Podiatry Practice Mastery. So under EBM, okay? It'll be down there. Okay, if you guys have any other questions about EBM, or you guys guys use it. Let me know what your thoughts are. But for now, patients seem to be fulfilling it. I think there's a couple that haven't filled. So if I look, I've done 13 so far, and 1, 2, 3, 4 of them haven't filled. So four of the 14 haven't filled. So I think there's some that just aren't going to want to do it, and then I'll kind of ask them when they come back in the future what's been working and what's not been working. Okay. Once again, you have any other issues or thoughts, let me know. If you want to get these resources, I'll put them on Podiatry Practice Mastery, probably on the bottom on that super footer thing that I have there. That's going to have EBM Masterclass.